Good evening or good afternoon. Welcome to State of the State. I'm Darlene DeRezzo, and tonight I'm in conversation with Dr. Nadia Archambault. She is a registered pharmacist. Welcome.
Hi, it's great to be here. Thank you for having me.
Thanks for coming. First thing I'd like to do is have you introduce yourself to our audience.
Sure. So I am a pharmacist, graduate of the University of Rhode Island, and I'm also a women's sexual health coach. I specialize in a lot of different medical aspects of women's sexual health and wellness, and I'm a certified sex therapist. So I combined all of my passions for women's health and not only doing the pharmacy part, but the coaching part also.
Perfect.
Yeah.
So Dr. Archambault is here to help us navigate the legalization of recreational marijuana use here in Rhode Island. So first I want to ask about marijuana and how it's classified now as a drug.
Yes, great question. So marijuana is still considered a Schedule I drug. So there's schedules 1 through 5 of different drugs. So Schedule I is still considered an illegal drug or substance. So that's why it's not federally recognized as something legal, because it's still considered a Schedule I due to its psychedelic activity that it can promote in the body when taken.
Okay, so what other drugs are in this class?
So something like cocaine, heroin, things like that are in Schedule I.
Okay, so this is something potentially serious.
Correct. Cannot be prescribed by a doctor legally. So
Marijuana.
Right, because it's a Schedule I drug.
Okay. So we do have medicinal marijuana available in Rhode Island. What is the difference between the recreational marijuana that is classified as a Schedule I drug and medicinal marijuana?
So medicinal marijuana is still the same as what recreational marijuana would be if you were to compare the substances. However, states have recognized marijuana as legally being able to use for medicinal purposes, but it's still not accepted on a federal level as acceptable for medicinal purposes, which is why it's still considered a Schedule I drug. So something that can be used recreationally can also be used medicinally. Now, someone going to get medicinal marijuana, they need a medical marijuana card, which they do get from a licensed physician, and then they are able to go to a dispensary, which is an infrastructure which holds medicinal marijuana or marijuana in different forms. And what makes that dispensary unique from buying it from someone on the street for drug use is that it is being monitored by the owners, the state, the town, where it's where the actual store or dispensary is, and there's security, there's all kinds of different measures there, but you do have to present your card to get that marijuana. There's also different rules and regulations for how many plants someone can grow, who is considered a grower, is what they actually call it, and the medicinal marijuana dispensaries get that supply. So there is some type of regulation behind what you're getting as far as the plant source from the marijuana plant. There's some dangers when someone might have a medical marijuana card and they think, okay, well, I'm using it for depression, for example, okay? It's dangerous to not go to a dispensary to get that marijuana, because if they were to get it off of the street from, it could be illegal, basically.
Right, we don't know what's in it, basically.
Yeah, you don't know what's in it,
right.
and that's the problem. It can be laced with different substances, which can be harmful.
Okay, so with a marijuana card, you cannot get medicinal marijuana at a pharmacy, you need to go to a dispensary.
Has to be dispensary, correct.
And is that nationwide, or does it just happen to be particular to Rhode Island?
It's just in each state, so different states that have legalized medicinal marijuana, not every state has this, then you have to go to a dispensary to get it.
Okay.
Rhode Island has legalized medicinal marijuana, so there are dispensaries in Rhode Island where you can purchase it.
Okay. You can go into a pharmacy, however, and get CBD.
You can get CBD.
So let's talk about the difference. What is CBD? Let's start there. What is CBD?
Yeah. So CBD is so marijuana has the components of CBD. So it's a cannabinoid, okay, and THC. CBD is THC free. Okay. So by law it has to have 0.3 0.3% or less of THC in it. So this is also where you have to be careful when you are purchasing CBD. There can be trace amounts of THC. However, what makes it legal to use, to buy in a pharmacy and in any state, it has to have less than 0.3% THC. THC is the component which gives people the hallucinations. It's a psychedelic component in marijuana. CBD does not have that component in it, but it has all the other health benefits that people use marijuana for. So that's the difference between those two. And then you have there was actually a synthetic human-made THC medication by prescription called dronabinol. You have to have a prescription. You get a prescription from your licensed physician or healthcare provider, go to the pharmacy, and they actually have dronabinol to dispense. And that's synthetic THC, which still can give people, it's a little bit of the psychedelic effects, not on the same level, but at least you know what you're getting is safe. That has been used for actually a long time, and it's used mostly for cancer patients. They need to put on weight, HIV/AIDS patients. That was where a lot of that was being used for. Glaucoma, patients with glaucoma also. And now CBD is something different where you do not need a prescription to purchase CBD. You can go to your local pharmacy and purchase it. And it comes in tinctures, soft gels, gummies, all different forms. However, there are a lot of different brands of CBD, so that's another thing you have to be careful about when choosing a CBD product. It's also dangerous when you are purchasing CBD in a non-pharmacy environment, such as, in some states you can...
You get it at a gas station.
Exactly. Literally go to a gas station and get CBD. I would never advise that. You want to go to a pharmacy, you can talk to the pharmacist about it. You know in that pharmacy they're going to be stocking those shelves with CBD, which is deemed safe and effective. And they can also go over your medications, if there's going to be any potential side effects or drug interactions with medications you're currently on. You can't do that when you go to get CBD online or in a gas station, for example. So as a pharmacist, I've done that myself with helping patients understand CBD and what is appropriate for them, how to dose it out, what their medical condition is, and things like that. So it's really important to talk to a healthcare practitioner about that. So those are the main differences with all the different CBD, marijuana, THC-free products and things like that.
So medicinal marijuana has the THC.
Correct.
Which is helpful for people with nausea, people who have lost their appetite and they need to gain their appetite back. You're saying glaucoma, HIV. Why then can we not find medicinal marijuana in pharmacies?
Because and this is something that may happen in the future. I'd like to see maybe dispensaries being handled more on a pharmaceutical level, but it's very hard to get the derivatives where you can really properly dose it out because a patient is essentially smoking it, for medicinal marijuana. If they're ingesting it, it's a little different. But it's hard to kind of calibrate and dose something like that out. And it's also still not federally accepted as a drug that can be prescribed. So until that happens, a pharmacy wouldn't be able to dispense that as a pharmacist because it's still considered a Schedule I drug.
Well, it also sounds like it's a little complicated to dose.
Correct.
So someone with, glaucoma, cancer, HIV, who's deciding what the proper dosage is?
Great question. There really isn't a good way to do that. There really isn't an organized way to do it. There are some practitioners who specialize in that, so they know a little bit more. But it's very hard to say, okay, take 2 puffs of, a smoking marijuana. How much is that person really inhaling? It's not like an inhaler where it's a metered dose. So it's very hard to gauge on how much or how little someone is actually taking or ingesting. Also, there are many different strains of plants out there. So the hemp plant, in the marijuana plant. So hemp also, this is another thing to consider. Hemp also has to be 0.3% or less of THC in it. So when you find hemp products and things that have hemp in them, so you're not eating marijuana, it's hemp. So there's like differences in that also. Hemp again comes from the marijuana plant though. So it all comes from the marijuana plant. But there's different strains, seeds, all different types of things, which is why it's also a danger when you're using it recreationally. Mm-hmm. You don't know what you're getting. Dispensaries usually have more of a handle on that, but it's hard to say because there's more and more opening up, and it still can be a little dangerous. But they have more of a handle on the products that they have as far as for medicinal. Mm-hmm. So yeah, there's a lot of different gray areas there. With CBD, a good CBD company will have what's called a certificate of analysis that comes along with that product, so you can see exactly what went into that product, where the plant was from, the percentages, everything. Another question we get a lot of in pharmacy is, can I still fail a drug test if I'm taking CBD? Yes, you can. There still is potential because there are still trace amounts of that THC in it. Mm-hmm. It's a lot harder to, but yes, you can. So you still have to take that in consideration with employers and certain jobs where you're still risking that. Okay. Yeah.
All right, so let's move away from medicinal marijuana mm-hmm. into recreational marijuana. Mm-hmm. So medicinal marijuana, we know, is regulated. The dispensaries have lots of checks and balances to mm-hmm. make sure that the product is safe. Mm-hmm. Recreational marijuana, not so much, right?
No.
And so we have decriminalized marijuana in Rhode Island, that's my understanding, and it's now moving from Senate to the House, working on making it recreational use legal. So what does that mean? What does that mean for children, adolescents?
Yeah.
We know that people are using medicinal marijuana for health benefits, CBD for health benefits, mm-hmm. and also to alter states, right? For anxiety mm-hmm. and depression, we're looking to change our mood. Recreational marijuana will do that too, but there's also a danger in that.
Yes, and the problem with that is...
in self-medicating.
Exactly. The problem with that is, and I think CBD is fantastic. I have seen it change people's lives. For pain management, they're using it I've seen it in topicals, also for anesthetics, and I'm actually seeing it now for women's health, for pain affiliated with endometriosis, mm-hmm. and for pH balancing. I've seen it do amazing, amazing things. The problem with recreational marijuana use is that there's the THC component, which can still alter someone's brain chemically. So if let's say they do suffer from depression, that over time can alter the chemistry in the brain. So that can actually have negative benefits. So they're getting that high that you get from THC, but long term that might not be the best thing for them. So someone who's suffering from depression may benefit more from CBD. But that would be on a medicinal level for medical marijuana. Recreational, right now we have a major crisis in this entire country with fentanyl. I've seen it firsthand as a pharmacist. We've almost had to become police with fentanyl.
Okay, yeah. So I'm going to pause you there just mm-hmm. so you can kind of expand on that. Tell our audience what fentanyl is and mm-hmm. why it's such a dangerous drug.
Yes, so fentanyl is used for pain management. It's used for patients with cancer, mostly cancer pain, severe bone pain, things like that. And what's happened is it's become another drug that's trafficked, and they're actually very, very tiny amounts. A small amount of fentanyl can actually kill someone if ingested. So fentanyl comes in topical patches, for example. There's people that have been melting it down and things like that and lacing marijuana with fentanyl.
Because
it creates more of a high, including, and they've been doing it with heroin also.
Now, would that also make marijuana more addictive?
Yes. It can. So the problem with recreational marijuana is you don't know what you're getting, and it can kill you with just using it one time. Now, depending on what Rhode Island laws pass with how much you're allowed to have in possession, if you were to, say, get pulled over and a police officer were to stop you, that's going to be questionable. I'm not sure what we'll see what they end up deciding on a state level. But then that still means that it may encourage people to purchase it recreationally. So, and like anything, like with alcohol, it can be abused. But the real issue here is that a lot of people are concerned about is that it's very hard to tell what you're getting in it. If you purchase alcohol in a liquor store, it's bottled, it's been manufactured in a distillery. Recreational, you could be getting it from someone on the street, and you don't know where that came from. So that's a big danger.
Yeah. And so the marijuana that's available now is not the marijuana available in the 60s?
Correct.
And we know that adolescents who begin smoking marijuana, their brains to some degree, well, they actually, what's the word I'm looking for? Sort of stop developing. Like they lose critical thinking skills, executive function, impulsivity goes up, and then addiction, of course. So marijuana is not the gateway drug, and yet we're finding it is the gateway drug at this point because of the way marijuana is, I guess, sort of grown and then sort of manufactured or laced.
Correct. And the THC component does also contribute to that.
Tell us.
So the THC component, which creates that high that people get, that can have addictive properties where someone is literally addicted to getting that high every time. CBD, which does not have THC in it, is not addictive. So that's important for people to know too. A lot of times they don't know the differences. For some people... repeat that again for the audience. Yes. So THC, which is what you get that high from with marijuana, that can be addicting for people because they want to continue chasing that high. They want to get high. And CBD does not have THC in it, or very, very trace amounts, where they are not, there's no potential for addiction to CBD for that reason. So that's a big distinction too. For some people though, with the THC is useful for people who need to increase their appetite, because that's another distinguishing point. THC will help increase appetite. CBD does not so much. But that's why that synthetic THC, dronabinol, is an option for patients, where they do not necessarily have to smoke marijuana. They can take dronabinol to increase appetite. So someone that has muscle wasting or needs to put on weight due to medical reasons, they can just take that it's a little capsule. They can get a prescription for it. They know it's safe, and they can get it right at the pharmacy.
Well, what do you think will happen if Rhode Island legalizes recreational marijuana use?
I think that what may happen is people start self-medicating and not seeing a healthcare provider if for something that maybe they need to see them for, and think, okay, well, I heard this works for depression, or I heard this works for anxiety, or I heard, things like that. I heard this works for migraine headaches. So they'll get it recreationally, because why bother going to a healthcare setting to get a medical marijuana card, or going into a pharmacy to buy CBD.
What do you think is going to happen to the adolescent population?
I think this could be very dangerous also. However, I don't know what age that's going to be legal for. It could be if you're in possession of it.
Well, I'm thinking 18 or 21.
Yeah, it might be 18. But again, it may possibly turn into a gateway drug for people, and it's going to be, just like someone purchasing cigarettes. If it's 18 to purchase cigarettes, it's easier for a 16-year-old to use a fake ID. They may look 18, they're not even questioned. And is someone who is dealing drugs on the street, so they're dealing marijuana on the street, are they going to check someone's ID?
No.
You know, and then but if you get stopped, yes, they're going to check your ID if you have it in possession, but that's if you get caught. So there's a lot of, there could be a lot of potential. This may increase a lot of mental status changes for adolescents that are taking this, because they're still developing, you know, a lot on so many levels. Their hormones are all out of whack, and you know, it's like typical adolescent years where they want to experiment but they don't even know their own bodies, and it could have potential dangers.
Does marijuana affect hormones?
Well, the marijuana with the THC, so medical, well, not necessarily medical, I mean recreational. Yep. Yes, it can. There's actually a whole science to it. We have cannabinoid receptors in our brain, and neurotransmitters are released when you are getting the high, but also when you take CBD, which can have benefits to it. But it can produce different responses in the body, and I have a feeling we may see more of a shift and it can cause more anxiety. Some people say when they get that paranoia when they get high with recreational marijuana. And anytime you are experiencing things like that with stress, your body's in stress, fight or flight, your cortisol levels go up. So that can all really cause a lot of different disruptions in the body too.
Do physicians warn patients who are getting medicinal marijuana of these side effects?
I hope they do. Most of them do. Good ones do.
You might be paranoid.
Correct.
Does medicinal marijuana, could that become addictive?
It could be, because it still has a THC component in it. So for sure, anything with the THC in it can have addictive properties because of that psychedelic effect it can have. I mean, some people can even have hallucinations and things like that on it.
Yeah.
So yes, there can be dangers to it.
Medical marijuana is available to people with autism, which I'm confused about. I'm a licensed mental health therapist, and could you tell me about why that might be beneficial to someone with autism?
You know, I'm still researching studies myself on that.
Okay.
I don't think we have enough data out there to draw definitive conclusions. It may help with the anxiety portion affiliated with it.
That's what I'm thinking, yeah.
So that's what I think it's leaning more towards. So that's where I think it's going as far as that. I haven't seen it as much with CBD being used for autism. They do have great CBD has great benefits. They've actually, the FDA has approved it for children for treatment of seizures, certain types of seizures. So that's pretty amazing. But as far as medicinal marijuana, it might be the anxiety part. But I think we still have a ways to go. And it's tough to do those studies because there's different strains of the plant. So it's hard to see what exactly they're taking all the time.
Okay.
That's where the challenge is.
So I think we're coming down to the end. We have a few minutes left. Can you address taxing and whatnot, or is that just an area that you're not familiar with? So let's say we do pass recreational marijuana laws. How this is going to be taxed, how this is going to move through the sale and delivery?
That's an excellent question. I think the state has yet to come out with that. I know in some other states it's going to be taxed like anything else, so the state or town where it's being sold in can benefit because they're getting income from the tax. But I'm not sure if they're going to say, okay, you can definitely purchase recreational marijuana here, just like they do with medicinal marijuana. I mean, people can buy it in vape pens now, so it depends on what they end up doing with it.
Okay.
So I guess we'll find out.
Well, all right, so we're down to the last few minutes. Anything else that you want to say about recreational marijuana use, medicinal marijuana use, CBD, before we shift? Because I'd like to spend a little bit of time talking about your other areas.
Yeah, so I think like anything, take everything in moderation. You are your own health advocate. Try to research as much as you can before you're taking anything. Research your doctors you're getting advice from, practitioners. and just make sure you're getting what you're getting, and getting it from a trusted source.
Okay. All right, so we're going to table that, and we're going to talk about this other stuff that you're into.
Yeah.
So you are a women's health coach. You are a certified sex therapist. What else?
Licensed pharmacist.
Licensed pharmacist. Okay, so yep, we've covered that.
Yeah.
So tell us about that. Oh, and you have a podcast.
I do. I have a podcast.
Yeah.
I have Ask Dr. A.
Okay.
And I also have a podcast coming out December 1st through Pharmacy Podcast Network called Sex PharmD. And it's going to address all sexual health issues from hormone replacement therapy, endometriosis. The sky's the limit with that, because I feel that is often kind of swept under the rug and not really talked about a lot. And I think that more people need to know about different health options. Yeah.
Why do you say that? Why do you say it's swept under?
Because I feel that I've had a lot of years of experience with women with hormone replacement therapy, low libido, all different questions they have. I feel like research really isn't there yet with where we should be for different things like endometriosis, uterine cancer, things like that. So I think I'm very passionate about it, and I think women are afraid to, a lot of women have been afraid to talk about it for a long time, and it hasn't been put out there. Everyone hears about Viagra for men, but we don't hear a lot about what our options are as women, so something I'm really passionate about. Yeah. Tell us about some of the topics you've covered on your podcast. Yeah, so I've actually covered CBD on my podcast. There's some creams that are coming out for pain relief for endometriosis. I've talked about endometriosis. I've talked about hysterectomies, hormone replacement therapy, estrogen, progesterone, testosterone, how to get your levels checked, things like that. And just all different other topics too, but those were some main ones that I talked about that I thought, and peptides. Peptide therapy right now so that's a really big therapy out now for a lot of different health reasons. You'll see a lot of it in anti-aging products, but they're actually using it also for low libido. There's a drug that came out, it's FDA approved, called Vyleesi, and that's a peptide, the first one to come out for women's to help with low libido, which I thought was pretty interesting. So there's a lot more moving towards FDA approval, which is really interesting. But that was like the latest one I talked about. Interesting. Yeah. Okay. And what do you have scheduled? What do you have coming up? Shows. Well, December 1st is the launch of Sex PharmD with pharmacy. So I've been working a lot on that. And I'm actually having a therapist on who I got certified with. I did a postgraduate certification with OBGYNs, other health practitioners. So it's all medical based and evidence based that we're talking about. And my next podcast episode is actually going to be shifting from more medical talk to communication and relationships and how that can affect you. So. Okay. Yeah. Right, so we're down to a minute. So I'd like you to tell our audience where they can find you. You get to talk into camera. This one? Right? And tell our audience where they can find you on social media. Yeah, so you can find me on drnadia.org. That has all of my info on there. Ask Dr. A podcast. And you can also find me on Instagram, and it's Dr. Nadia PharmD CST on Instagram. But if you go on drnadia.org, that has everything on there. Great. Yeah. Thanks again. Thanks for having me. Thanks for coming in. So thanks for being with us tonight, or today if you're watching during the day. I'm Darlene DeRezzo. You can find us on YouTube and our new Instagram, which is @StateOfTheStateRI.